So did your father stay on the antifungal agent after he left the intensive care unit? Tell us a little bit more about the experience with the antifungal. I know you had a lot of other drugs on board, but what do you know about that experience?
That was actually a lot more seamless than I anticipated it, especially since it's more of a specialty medication. So he was discharged from the ICU and they continued that on a step down unit. And then when he transferred to the rehab facility, they continued it there.
November, December, he was on it for 3 months.
Wow. Okay.
So I started it that same day that I got the galactomannan back, which was on October 27th. I immediately started him. You get a loading dose and then for 3 days, but that was IV. So all the time he was in the intensive care unit, he was getting the IV preparation of isavuconazole, or the real name is isavuconazonium sulfate. So you have to say that 3 times fast to see if it works. So he was on that IV, but I think actually once he was sent to rehab, he was sent on the, now I have it, it was on the 22nd of December, right before Christmas, is what I have. No? Or was it the 28th? 28th. Yeah, the 28th. I'm sorry. I can't read my own writing. So the 28th of December, he was sent, and we actually have a lot of good relationships with the rehab unit. So we were able to talk to the infectious disease doctors there and tell them what was going on. And so the communication, and I think this would be the other part, the communication between the acute care and the rehab facility and the infectious disease doctors and the hospitals there in the rehab facility was very important. We were trying to get the oral preparation, but they were not doing the feeding tube. So he may have been on it until he left. And then he was put on, and I remember the conversations we had on with Angela. I don't want him going home on an IV. I don't want him on a PICC line. I don't want him on a midline catheter. I want him on oral treatment. And and lo and behold, we were able to get him that oral treatment for, I think, another 10 days, something like that. I think it was. So I think more than anything was the communication that we have, that we all should have with the rehab facility, as far as working together and in conjunction, right, to improve the access from acute care to the rehab facility.
I wanted to make sure he wasn't sent home with a line if he didn't need it. I wanted to, get rid of any vascular access if possible. So that was a little bit of a challenge, just because I think providers, if they weren't, especially at a different facility, they can be sort of reluctant to make changes, especially with something so specialized. But thankfully I was able to get one of these guys on the phone and help kind of guide them to how to adjust the dosing and, to do an oral form. And then I guess the biggest thing is I know how expensive it can be. And so I still had my dad's wallet from when I'd taken him to the emergency room. And so I was very nervous going to pick it up. It's one of the bigger jobs in the ID clinic that we have. We're all very mindful of cost to the patient, which I think is so important. And I have to say, I was kind of worried that, I might get up to the counter and it'll be thousands of dollars for this regimen, because he had to continue it. I think he was discharged on January 15th, and then he had to continue to the 27th. And when I got it to the counter, I had somebody who's like a super user in the pharmacy, and this is at the retail pharmacy in the hospital. And so, well, let me just use this coupon thing that I have, and let me check with this thing. And they told me it was going to be $25. And I'm not kidding. I cried on my way out. Just, they really kind of went above and beyond to make sure that they had kind of knocked down the cost as much as they could. And then thankfully he's got Medicare as well, which seemed to take care of a lot of it as well too. But that was really significant, because I know that's not the case for everyone, to get up to pay, and it's something you can't afford, and it's something that you so desperately need, which would have been really difficult. I mean, we would have made it work for sure, but it sure was nice that it wasn't several $1,000s.